There are many reasons why a patient could be agitated in the inpatient and ED settings. For example, patients who are intoxicated or undergoing drug withdrawals may be irritable or agitated. Patients with active psychosis in different conditions, such as schizophrenia or schizoaffective disorder, bipolar disorder, or depression, can also show signs of agitation. Patients under a lot of stress or with trauma backgrounds may also present with agitation. Dementia, confusion, and many other medical conditions can also contribute to agitation.
Here's some other things to consider or ask yourself when a patient presents with agitation. Is the patient agitated for some sort of secondary gain? Patients with IDD may be expressing pain or frustration through agitation. Verbal redirection here can be helpful. Patients with akathisia, an adverse effect of antipsychotics, may appear to be agitated due to feeling restless with a need to frequently move around. These patients may not be actually acutely agitated. If the patient's mental status is acutely altered, think about delirium or even acute intoxication. With the medically frail and geriatric population, falls are a big deal, so you want to try to make sure to keep them safe, especially when agitated. The pregnant and pediatric populations have special considerations that are not discussed here in detail. However, one thing to keep in mind with pregnant patients is that medications may take longer to clear from their system.
Here is a common communication you might receive from nursing staff. The first step in this case is to assess the situation by talking with the nurse. Ask what specifically is happening. If it is safe to do so, you should also talk to the patient and ask them what is going on. Sometimes a change in environment is necessary to keep the patient and others safe from danger. If the patient continues to engage in aggressive, dangerous, or unpredictable behavior, you may want to consider placing an order for close observation with either one or two staff members. One-to-one close observation means that the patient must be in the field of view of a staff member at all times in order to keep the patient and others on the unit safe. If the patient is still agitated, you can offer an oral medication to help them calm down. Some common oral medication options are listed below. If the patient is agitated, refuses to take oral medications, and there is a high risk of imminent danger to the patient or others, emergency medications administered intramuscularly can be ordered to protect the patient and others around the patient. Make sure to check your unit policies as far as documentation goes in an emergency situation. When ordering emergency IM medications, make sure to consider any comorbid conditions that the patient has because there are some contraindications to some medications. If the patient had a recent drug overdose, you most likely will try to avoid the medication that they overdosed on. If the patient has a significant cardiac history or extremely elevated or low blood pressure, exercise caution with certain IM medications. For example, consider haloperidol instead of olanzapine, as haloperidol has less of an effect on blood pressure. The following neuro concerns are rare, but make sure to consider them when ordering emergency medications. If the patient has a history of a serious blood dyscrasia, exercise caution with IM medications. With mild hepatic or renal impairment, a one-time dose of emergency medication may not be an issue. However, these medications may take longer to be cleared out of the patient's system, so if a patient needs multiple doses, exercise caution. You may also want to consider using a lower dose antipsychotic on these patients to minimize the risk of EPS side effects, or consider using a benzodiazepine instead.
As far as oral medications go for severe agitation, this table lists some of the most common medications that are used. We won't go through all of these in this video, but you can come back to this table for reference later. Check with your attending physician before ordering any medications, especially if you're unsure of what would be best for the patient. Listed here are some common intramuscular medications that are used in patients with severe agitation. One very important thing to note is that IM olanzapine and lorazepam should never be given together due to a serious risk of a respiratory depression. Diphenhydramine is often given along with IM antipsychotics to reduce the chance of extrapyramidal symptoms.
Now, let's get back to our scenario. What if the patient received medication for acute agitation and was given time to calm down, but they're still agitated? The first step here again is to assess the situation. Ask the nurse what specifically is happening. If it is safe, you should also speak with the patient. Then, consider if the environment needs to be changed, as discussed at the beginning of this video. Regarding the medication that was already given to the patient for agitation, you'll need to decide if the medication was either effective or not. If the medication was not effective at all, you can try a different medication. If the medication was partially effective, depending on how long ago it was administered, you can either give another same dose or an increased dose. If the medication was effective but wore off too quickly, again, depending on how long ago it was administered, you can give another dose of the medication or a different medication if it's too soon for another dose of the same medication.